Imagine our immune system cells, which normally protect us from invaders, from bacteria, viruses, and fungi, sometimes mistakenly attack nerve cells and destroy them, and they progressively destroy brain and spinal cord, and it is called multiple sclerosis. Multiple sclerosis is a very dramatic disease because it can make marathon runner to unable to walk. It can make designer to unable to hold pen correctly because of shaking and weakness of hand, and it can confine person to wheelchair. And problem is, it's very difficult to detect and diagnose multiple sclerosis at early stages because its symptoms varies greatly. That's why we will explore 7 earliest symptoms and signs of multiple sclerosis. First symptom is chronic fatigue, which is not alleviated by rest. So person always feels tired. Of course, it's not specific symptom for multiple sclerosis. Fatigue can be caused variety of problems, but in 90% of people who are diagnosed with multiple sclerosis usually have fatigue, chronic fatigue, and even years before diagnosis of multiple sclerosis. So first symptom can be fatigue. Second symptom is tingling and numbness in hands, feet, leg, and limbs generally, and face. Its second most common symptom, numbness and tingling. Person can lose sensation in the hand, for example, or sense of pins and needles in the legs, for example, or feet. Its second most common sign. And third sign is Lhermitte's sign. It means when person bends head forward, he feels electric shock like pain through the spine. That's Lhermitte's sign. It happens because immune system cells destroy myelin, and myelin is protective tissue which protects nerves. It's fat tissue which protects nerve, and when immune system cell destroys this tissue, it is called myelin. Then these nerves are exposed and nerves become vulnerable and more sensitive, and person feels such electric shock like pain when moves head forward. Fourth important symptom is eye problems. It can be blurred vision or double vision or nystagmus. Nystagmus is involuntary eye movement, and loss of vision also, usually in one eye. It usually happens in one eye, not both eye together. It can happen both eye over time, but one eye at a time. That's important. And difficulty walking. This difficulty walking symptom is progressive. It can be very mild difficulty walking, usually weakness in one leg, but it progresses over time. And 6 is memory problems and cognitive decline generally, and these memory problems can be symptom of multiple sclerosis. And frequent urination, urinary incontinence, and constipation. It can be 7 important and early symptom of multiple sclerosis. Now let's say how we diagnose multiple sclerosis. Based these symptoms, but several of these symptoms should happen, but not at once. They should be disseminated in time and space. So 5 years ago, person can say that started, for example, fatigue, and after several months there was numbness in the hands, and after 3 years he had, when he bends head forward, he has electric shock like sensation. So these symptoms are disseminated in time and space. That's important for multiple sclerosis, not at once. The symptoms does not start at once. They are disseminated in time and space. And MRI is very important diagnostic tool, magnetic resonance imaging, because we can see spinal damage or brain damage and multiple damage, different areas. That's why it is called multiple sclerosis, because dead tissue is called sclerosis, and it's in multiple locations. That's why it is called multiple sclerosis. And what is treatment? Treatment is disease modifying therapies. Usually these drugs suppress immune system activity and modulate immune system. Usually they are anti-inflammatory therapy, and they are effective if started early stages. They slow down this progression of the disease. And for prognosis, early detection is very important because it improves prognosis greatly. For example, if person gets no treatment, lifespan can be shortened by 10 years. But if person starts treatment earlier, then this person can live normal life, whole normal life, normal lifespan. So treatment is crucial. Early treatment, early detection is crucial at these cases. And it's more common among women, 3 times more common, and usually occurs at the age between 20 and 40. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.